Welcome, everybody. Lovely to see you all here today, or to hope that you are with us. Welcome to the FIP CEO Podcast's 2023 In Conversation. So FIP is seeking to develop a series of podcasts where me, the CEO, has a conversation with a fellow leader in pharmacy around areas of shared interest and things that we've been discussing for a while. These have all emerged through the conversations we were having at various meetings during the pandemic, where we found that our values aligned and our friendship has blossomed. And some of the areas we've discussed during the past months and years might be of use to others. So before we start, a few words about me. I'm FIP's Chief Executive Officer, Catherine Duggan. I am a pharmacist myself, and I've had years of experience in community, hospital, academia, policymaking, and in professional bodies. And my partner in crime today is a superstar called Shelita Dattani. We've got 3 episodes of our podcast. Today's the 3rd, and it's in a conversation with Shelita Dattani. Over to you, Shelita, to tell us a little bit about yourself.
Hi, Catherine. It's so nice to be with you again. I'm Shelita. My friends call me Shelly. So hopefully all of you are my friends or will be soon. So just take off the TA. I'm the Senior Vice President of Pharmacy Affairs and Strategic Engagement, big long title that doesn't matter at all, at Neighbourhood Pharmacy Association of Canada. And I'm also a practicing pharmacist. I still work once a week in a clinic environment, and it really grounds me. I'm a mother. I'm a friend, I'm a wife, I'm a daughter, and I'm just super excited to be here with my colleague and friend Catherine today, who I admire very much.
Yeah, we're a mutual admiration of each other, Shelley, and it's been wonderful to get to know you during the pandemic. And I think it's one of those things that happens to you, and you should cherish it and treasure it. We met across a crowded screen around issues pertaining to professional life. And at that moment, professional, personal, it all melded together during the pandemic. And we really got inspired by each other's thoughts about work-life balance, the anomalies of the resilience mantra, thinking about what would we have told our younger selves, if we could go back and tell ourselves what would that be? Issues around career development and advancement. And when we get to the senior echelons of holding a big title, was it that simple to get here? Probably not. Leading in practice, managing in crises. And the 3 podcasts have really focused on elements of these things, but there will be an awful lot of overlap. So we'd encourage everybody who's listening today, if you haven't, go back and listen to the first 2 and tell Shelley and myself if there's anything else you would like us to discuss. We're going to do a little bit of a chat between us, sharing some of the concepts that we've developed around resilience today. Think about some key take-home messages as we go. And then what would we tell ourselves if we could go back and talk to our 25-year-old selves? I think that's such an important point. Really exciting to spend some time again with you, Shelley. Thank you so much for your time today. So today it's about resilience. What does that mean to us? What's the positives? What's the negatives? What does that mean? How have you learned to be resilient? And I'm going to start, Shelley, by asking you, when you personally think of resilience, what traditionally comes to your mind about that concept?
Yeah, we've heard a lot about resilience, haven't we, Catherine, especially in the last few years. And I think resilience is a very, very tricky word. And I think at its core, it's about, being adaptable, being flexible, focusing on what you can control and bouncing back, whether it's from adversity or challenge or whatever it is. I literally think about an elastic band, like just being able to bounce back and adapting to difficult experiences in life. So whether it's mental health or demands as a professional, as a pharmacist, trying to bounce back and focusing on what you can control. And I think it's a good word, but I think it's also a very tall order, right, Catherine? What do you think?
I also think it's become very value laden in recent years. I think it's also changed, and it's also up to self-interpretation. So resilience, perhaps in our parents' generation, may have been thought of as strength and firmness and sticking to your views and your values and being very, very resilient in that way. Whereas actually for us, it probably means bending and flexing to whatever you're encountering. But Shelley, we spoke about the fact that you've got to be resilient. You've got to build resilience. It comes with a lot of baggage. It comes with a lot of blame and blameworthiness, which during the pandemic, you and I reflected that it can really grind you down if you feel that you're not being resilient enough and you're not caring enough, or you're not coping well enough. There's all those words there. In the Authenticity podcast, we spoke about being too much of something, but here it's about you're not enough of something. And that's a really, really tricky thing to balance. And I think that's something that we have to put on the table, Shelley, that it's not just about being a superstar, being so resilient, learning from yourself and managing everything. Actually, it can feel too much. I don't know whether you've got a reflection on that, but I know that you really opened my eyes to this idea.
Yeah, I do. I think that there are today's definition of resilience, as you said, I think is important, and there is some value to it. And I think it's really important to foster self-care in our lives as humans, as professionals, to take time for ourselves. I try to be really conscious of that. Somebody said to me recently, or I read somewhere, and I thought this was brilliant, is that like the onus is really put on you as a person to be resilient. And I think we'll get into that a bit, Catherine, but so I read this, it was like sort of no amount of yoga is going to relieve the stress of the system and of the things I can't control. I can do yoga all day long. And you hear about this, do yoga, meditate, be reflective, journal, do all of these things. But at some point we need to look at, when you don't have control of the entire situation, and is the expectation or the onus on the individual to be resilient enough, and I think we've had a real loss of sense of control over the past 3 years. And so how do we look at that now?
I also think, Shelley, we talk about being out of the pandemic, and perhaps we are out of the immediate crisis. But what we've seen in our workforce is, and this is, you and I really were quite wow when we were explaining to each other how it felt in our nations or with our colleagues. This whole idea that the pandemic's over and everybody has bounced back like the elastic band that was supposed to be just is not true. And this is also playing into the narrative, the self-narrative of I'm just not enough. I'm not enough for the system. And also, Shelley, another point that we wanted to raise today was when you're feeling mentally frail or fragile, and when we spoke about mental health, when you've got your mental health, you don't think about your mental health. It's when you're feeling frail and fragile that you understand that this could lead to something else. You need to be able to lean into that a bit so that you don't become over resilient and push on through to face something more of a crisis. So we had lots of chats about managing a crisis is easier than managing the coming out of a crisis when it's all still ahead of you. And our workforces are absolutely frazzled, technical terms, burnt out, etc. But it's a lot, and that you have to still keep on bouncing back, taking on more, being pleased with your lot, let alone the system that you're working in, Shelley. I think it's really tricky for people to absorb this notion that it's all down to you and your yoga practices and your chamomile tea. Yeah, I'm with you on this. Giving myself a longer to-do list just means the to-do list gets longer. It doesn't mean that I'm feeling better.
Yeah, Catherine, I think that's exactly right. And I think we have to think about that. And I think about that in our work at Neighbourhood as well. And I'm sure you do, as we go to advocate for the profession in the sector, and we continue to ask for more. And yet we're asking, burnt out, exhausted professionals with moral injury to be resilient. We have to think, I think about, what we're going to do to foster those environments. And when we think about the workplace, sometimes I think about resilience sort of like we think about diversity and inclusivity and that whole sense of, whether it's bias in creating an inclusive culture, that the onus is on all of us to do that, right? It's not on the person that's feeling excluded. So I think it's the same thing with resilience. It's really, we need to look at organizations, at workplaces, at systems, having some responsibility for fostering the resilience around that individual, for fostering collaboration, for building resilient systems so that we can kind of strive to move forward together. And because I think, as you said, with the to-do list, just putting the onus on that individual, I think just adds to their own stress.
Yeah.
And so building that together is really important.
Well, it's really important. I think the 3 podcasts have picked on different elements of this, and why we left resilience to the end is that without the understanding of authenticity, and we'll come to that in a second again, and then also this whole idea about work-life balance, we really need to understand that we are part of the system. And you and I, as leaders, we need to walk the walk as well as talk the talk. So if we really believe in resilience as being a good trait for people to have, we need to think about the systems that we're creating and making sure that people have autonomy, purpose, reward, and some kind of purchase over the deadline, over the volume of work, over the feedback, so that life doesn't become one constant pitch of stress the whole time. I think that's really, if we go back to authenticity, I think, Shelley, you and I have to be able to look each other in the eye and say, when we talk about resilience, are we really practicing resilience in our workplaces? Are we really advocating for this when we go and argue for a new service for pharmacists to deliver, or a new guideline for my team to work on, or a new project? Are we really doing it ourselves? And I don't know how we might give those checks and balances to colleagues on the podcast.
Yeah, I mean, I can share an example if you like, and I really want to be very sensitive to this, because we've even been challenged by our own community saying, you're telling us that you're going to keep us safe. We're all, the professionals are exhausted, but yet, do we have room to do more? And sometimes governments will say to us, we want more scope or this or that, but don't you have a human health resources challenge? Isn't the workforce exhausted? And so part of, I think, what we talk about to governments, to regulators, to others, is how can we build some enablers as we ask for pharmacy to go to the next level? Because I think we all want to see ourselves as healthcare providers continuing to move forward. How can we ask or advocate for the enablers that can build that sort of resilient environment that I spoke of? So when I think about, what I want to do is help put a pharmacist in front of a patient, which is sort of where they want to be. And so sometimes it's about talking to governments about reducing the administrative burden or the documentation. I'm just speaking to the Canadian system, but there's a lot that's imposed on pharmacy in terms of, either paperwork or lack of scope, or not having pharmacy technicians, or not completely leveraging technology. And so I think if we can also look at, in our role, how can we further enable, how can we reduce barriers, and how can we help build that resilient workforce as we continue to also want to drive the momentum to bring the profession forward. So I think we have to sort of be conscious of both sides of that. Is if we're continually asking for more, we have to be able to enable our teams to do that successfully. And I think that goes for the workplace as well. I think that employers and work environments want to think about collaborating and understanding what their teams and their pharmacists want to do, so that they can adapt themselves to try to make that happen.
Yeah, I couldn't agree with you more. I do think there's something about expectation management and infrastructure building. And I know, we can't always build the system ahead of doing the innovation or doing the extra services or doing the extra piece of work. But I think people have got a sweet spot of delivery there, and they will adapt, but only for a time. And then they'll get frazzled and they'll get burnt out and they'll get very disillusioned. If we have, as leaders, overpromised and underdelivered, there's something as well for our profession where, and I think COVID has done a great deal, because the lights stayed on in pharmacy everywhere globally, Shelley, every single country, every single nation, every single region. So paymasters, health ministers, governments, they understand the benefit and the impact and the importance of pharmacy, especially as health systems are more fragile now post-COVID. But we do need some investment, we do need some remuneration, we do need some infrastructure, and we also need to be respected for that. And having that advocacy conversation without seeming to be needy to be at the top table of healthcare, and with being confident to say we have a valuable contribution to make. I think that's probably something that we as leaders know that we should be doing. If we expect them to go the extra mile, we have to go that extra mile and have those difficult conversations. That came back, Shelley, to the authenticity piece, that, you know, in your position, you have to be able to look the profession in its eyes and say, yeah, I did my best for you there, and look at where we have come, and let's adapt accordingly. I don't know whether you've got another example you could share with us on that, but I think this is the crux of resilience.
I think that's brilliant. And I think, and maybe I'll just add maybe to what you said. And I think that we often say, you know, we kept our lights on when everybody else was closed, we were open, thinking back to 2020 and people sacrificing their lives and putting on full PPE, and, you know, everybody else was closed. You know, some emergency rooms and some pharmacies were open, but I think we wear that as a badge of honor, but we're also, maybe we shouldn't so much. And maybe we should say, you know, we were agile, but you have to also, as you said, governments, others who can help us move forward, have to value that and have to really think of us as healthcare, and we have to harness together what we've done in the pandemic and move forward. But I think assuming that we will always just continue to do that without the support, without the enablers, is doing ourselves a disservice as a profession. So absolutely, you did, Catherine, I did. We worked really hard to continue to advance the profession in the sector through the pandemic, but we have to care for them so that they can care for their patients. We have to keep our workforce safe so that they can keep our patients safe. And so I think caring for those who are on the front lines is an enormous responsibility. It's one we can't take lightly. And if we're going to continue to be authentic leaders, all of us, we have to take care of each other. So I think that's what I would share back.
I couldn't agree with you more. I think there's something I've heard in the language in the past few months, and we're recording this in end of April 2023. So maybe things will change, but I've heard the othering of healthcare professionals, of healthcare workers by governments and health ministries, as though those individuals who are delivering frontline services are not part of the population that has been impacted by COVID and through COVID, as though those people on the front line didn't experience all the grief and loss and constraints on their lives. And actually they had even more than you and I did. And I think that's what made us super humble. But Shelley, we've really been talking here about health workforce and systems, and talking really at that higher level and our responsibility as authentic leaders. But I remember you telling me one of the top tips you had for authenticity and then resilience was having this level of self-awareness. Now, what do you think that has brought you in terms of your own resilience, but also then being able to be authentic?
Yeah, well, I think I loved what you said a minute ago about feeling othered. Like healthcare professionals are supposed to have some level of armor. They're not allowed to be vulnerable. They're the ones taking care of everybody else, but we also need to be taken care of too. So I think it's just the awareness as a human and as a leader that, you need to think about yourself. You also need to be looking around you at your colleagues to see if they're okay. If it's somebody who you work with, whether you work in a hospital environment or you work in a community pharmacy, and your colleague or your assistant beside you is maybe burnt out, is suffering, has maybe had a family member have something happen to them because of COVID, is maybe going through their own personal struggles. I think that self-awareness is really, really important. And I think just, I love what you said about the othering, because healthcare providers are humans. And so we are not and have not been immune to all of these challenges ourselves. I think back to Omicron, when we were so short-staffed, and compounded by that was the fact that so many healthcare providers had gotten COVID themselves and were off work and could have been, quite sick, maybe not as sick as with Delta, but still sick, or may have, been caring for a family member. And is there the room to do that if you're a caregiver and also a healthcare provider, or a human being that's also contracted the virus and also a healthcare provider, somebody who has, mental health challenges because of the pandemic and also a healthcare provider? So I think I think it's back to that, would love for people to listen into the Authenticity podcast and let us know what they think. It's about, I love what I keep going back to you talking about the othering, because I think that's just brilliant, Catherine. Like, we are whole people. We're not just healthcare providers. We're not just leaders. We've all been hugely challenged by the greatest crisis that we've ever faced in our lives in a generation or two.
I know. And, I have to say, when I was thinking about resilience, I was also thinking about the way in which systems can cause people to feel non-resilient. And where's the line between expecting a lot from your workforce, but then crossing over into more of a bullying culture? And yeah. I really must say, Shelley, and I would really get people, if they listen to this straight now, and even if they listen to it in a few months' time, have a think about the language that is being used around healthcare professionals, health workers, healthcare workers. And this othering is real. And I really feel it's about getting the public to think we clapped for them during the pandemic and now they've got to get on with it, when they may be asking for a raise at work in times of inflation, or they may be asking for better recognition. And that, I think, is something that's not even coming from a political standpoint. It's the idea that we were all in it together when some of us in healthcare professionals gave our all and others didn't have to. And now that the times are calming down, they haven't calmed for healthcare workers or healthcare professionals. They just have not calmed. But then there is this. I'm keen. You've got me thinking about being authentic. And I think for you and I to come on a podcast and think that it's all fine now would be inauthentic. It would be wrong. So if we're going to live by what we say and we're going to live by the values we hold, we should say part of this is you're weak because you're not coping, or you're a snowflake, or you are greedy because you want a pay rise, or you want to be remunerated. You should be doing it for the greater good. This is not appropriate language from healthcare leaders and ministers and those in power of pay and conditions, if you like. And I think taking that back to the center point about understanding ourselves, we talk about mental health as though that's the state that we should be in. And as I mentioned, mental health is not a currency. You don't spend all your mental health and then not have it. We have it. We don't know that we have it. We only feel the absence of it. And we don't call mental illness. We just call it mental health. So it's really confusing for people. If you aren't sleeping well, Shelley, if you are increasingly anxious about something, if you're particularly stressed, if you've got other things going on in your life, you might not categorize that as being mentally fragile, frail, needing a rest, but you might think of yourself as not being resilient enough. And that's a real danger, I would say. And then if you hear the narrative there about, to be a good professional, you need to be X, Y, Z, you're not giving yourself that bit of kindness that you would to a patient in front of you. So I think probably that the health of our workforce should be a really important thing for leaders like ourselves. I don't know, and you're a mum and a wife and a daughter and a friend. I'm sure that you've got examples where you can see it in others, and then as healthcare professionals, we often don't allow ourselves to see it in our colleagues and our workplace chums, if you like.
Yeah, I mean, I think we sometimes say to each other in passing, like, how are you? Are we really interested in how people are when we ask that? And sometimes I'll try to say, whether it's to one of my kids or a colleague or whoever, is to say, are you okay? No, are you really okay? And again, it's about that, that first discussion we had about authenticity is to show your own vulnerability, ask those questions so that people feel like, okay, she really wants to know if I'm okay. She's not just asking in passing, it's a greeting. She really wants to know if I'm okay. So I think that's hugely important. Catherine, I wanted to sort of ask you a question and maybe pivot a little bit to this idea of the onus is on all of us to take care of each other, right? So we've accepted the fact that resilience is an important word, but it puts a lot of onus on the individual. And then we've talked about workplace resilience a little bit. Let's take it up a notch. So in your role at FIP, when you think about the system, and we talked about the fact that the individual is part of that system, what does system level resilience mean? Like what does that mean to you?
Well, isn't this very interesting, Shelley? Because recently we've been looking back at pre-pandemic, what was influencing our business plans and our programs of work on a global level. And we looked back at the global threats, the 10 global threats that WHO had identified in 2019. And one of those in particular is fragile primary healthcare. Now, for some of us in the UK or in Ireland or in Canada, we might think primary healthcare means primary care. It doesn't. In WHO and UN terminology, it means where you get your first point of call. And that can be a hospital for many. Now, if that was an issue in 2019, I can tell you it's a wholesale issue now. And add on that, you've got wars and conflicts and earthquakes and terrible natural and man-made disasters, or human-made disasters, should I say. And I think the frailty of systems has been shown to be really evident. In the UK, having a national health service that everybody is really proud of, that had suffered a decade and more of austerity prior to the pandemic, meant that any holes that were there, a bit like a family, Shelley, any kind of frailties or vulnerabilities that were there during the pandemic, there was a big light shone upon it all, and lots of the inequities were really highlighted. I think the biggest issue here, and I think you tapped on it right at the very beginning, is equity, equality, respect. And in a health system in any country, if you have that, even before you have the dollars or the pounds or the euros, this is what will make for a strong system, because then everyone feels they have a space and a place, and that they are supported to be the best they can be with the resources they have. And that would probably be the take-home message. And we know that from the high-income countries in the pandemic, they did know better, more or less. I mean, there are exceptions, but if you weighed up the balances about high and low-income countries and also spend on health, and you looked at who did better through the pandemic, it wasn't the income status of the country at all. So if you take that out, it's about where the dollars and pounds and euros are spent, and it's about the respect with which their workforce is treated and held in society. I actually think it's the best example and experience of our lives, especially from somebody who wasn't on the front line, who was privileged enough to sit behind the screen and meet colleagues and friends such as yourself, Shelley. I think if we do not learn from that, and we allow the curtain to come back down on our health systems and become the blanket again, I think we've missed a trick. So I think that the Human Resources for Health in 2018 had a phrase, no healthcare without a health workforce. Well, how hilarious is that now? Literally. And for us, we've adapted that at FIP, no pharmaceutical care without a pharmaceutical workforce. So the predominant thing, Shelley, it's not about the medicines, it's not about the vaccines, it's not about the water, it's not about the society. They're all hugely important. For us, it's about the workforce. And we are people as well. We live in our communities, we live in our families, and by day we're a worker, by night we're a family member. So this kind of really pulls together everything we've been saying in our 3 podcasts. That Shelley, the woman, Shelley, the leading pharmacist, is one facet of her life. But if you do not bring all of the other elements to the story, Shelley, we're missing a trick. So if you don't bring Shelley the mother, Shelley the daughter, Shelley the wife, Shelley the friend to your encounters and your advocacy for the workforce, I think we will slide back again. And my ambition would be to make sure those 10 global threats that WHO raised in 2019 are abated as much as possible, as much as we can, because I'm not going to say we can save the world, Shelley. That's another thing. Taking on too much is really bad for us. But this really pulls together the whole ethos of everything we've spoken about. Being your authentic self should not make you feel weak and vulnerable, but feeling weak and vulnerable about other elements shouldn't make you feel a failure in terms of resilience either. And balance, who knows what balance is really, Shelley? Literally, isn't it about the day you're in and how you're feeling and what's ticking your boxes? But yeah, I don't know. That's a bit of a rant from me. You've got 2 sides of a rant, but if you can't do it on a podcast with a very good friend, then when can you do it? Does that resonate with you, Shelley, would you say?
It really does. And I think a couple of things that you said, I'll pick up on just for a second before we close out. But I think one thing is bringing your whole self. So it's back to the authenticity. And again, listen to what we said on that podcast, because I think about when I maybe when I'm doing a presentation, or I use the example of talking to governments to advocate, because that's a lot of what I do in my role. I really do try to bring the human side of myself. I think storytelling and evoking, when you're talking to governments, some of that emotion of what you may be experiencing. I will share stories about what I may have seen in my own practice as a pharmacist, or what colleagues have seen, or that I worry about my parents in today's healthcare system. If I'm trying to make a point, I think it helps round that out. If I bring not just, I'd like to advocate for pharmacists to be able to prescribe minor ailments in this jurisdiction, but really talking about why I'm worried as a human, as a citizen, as a daughter, as a patient care provider, and as a patient myself sometimes in the system, which I, maybe later and have been now. I think that really rounds out, if you can demonstrate that authenticity to whoever you're talking to, I think it evokes a better understanding, and it's more real that way, right? The other thing that you said that I wanted to pick up on that I think is really important is we talk about this system level change, and you've talked about some really big things, and you've been dealing and navigating through many healthcare systems in your role as FIP of CEO. But I think we have to accept that, as people say to us, like, I can't wait for the system to change. I'm burnt out. I'm exhausted. I think we have to accept that system change does not happen overnight. It can be incremental. I think we have to recognize and celebrate incremental change. And I think we have to, as you said, reflect and look at a bit of maybe a CQI approach, like a continuous quality improvement approach. And each change that we make, was it good? What went wrong? What went well? Let's go on and keep working and moving forward. I think that's something that we want to see. I think we've already seen incremental change, sort of the big picture, but I think in your own environment, encouraging the people that you work with to activate that incremental system level change is going to help with that system resilience as well.
You know what, Shelley, you've just said it so perfectly there. Don't wait for the big bang. Don't wait for the new system to be in place. Create the new system step by step by step, like climbing a mountain. You can't climb a mountain without taking the first step. And that really helps you if you're having a bad day compared to a good day. One step is enough. Maybe today you can't do the 500 steps that you thought you were going to, figuratively. Right. And it means that then we are part of the system and we are part of the solution, rather than feeling othered by the system. Yeah, to come to that word again. I'm going to say, Shelley, because, we do have to wrap up. What would be, from our discussion today and from our 3 podcasts, what would be a key takeaway? You can have a couple if you need, to tell the 25-year-old Shelley way back then, if we've got some listeners who are perhaps at an earlier career stage, what would be your take home around any of the issues we've discussed?
Such a good question. And part of what I do is I mentor either students that I've had before or new grads, and I have regular conversations with a few people who are in my life, and I learn from them as much as I help teach them. So I think that's also important. But I think our new grads, at least here in North America and definitely in Canada, and our students are coming out into the workforce, and they're expecting to work to full scope. Maybe they don't want to dispense as much as a previous generation did. Maybe they want to prescribe, because we're talking about a lot of that in Canada. How can we help them realize, that incremental change that we just talked about is possible? And how can we inspire them to be activators of the change? Because what we don't want to happen is we don't want early cynicism. We want them to move us forward and sort of pass that baton over, so that they can continue to propel. So I think if we want to do that, it's if we're going to be authentic leaders and mentors and pharmacists, I think we need to provide that safe space for them to feel that they can be authentic and drive that change. We need to understand what motivates them. We need to authentically ask all of the questions and listen more than we talk. And so I guess it's not as much, maybe it's advice, maybe it isn't, maybe it's advice to all of us. But I think what I would say to the 25-year-old is, you do have the agency to create the change that you want. As Gandhi said, be the change that you want to see in the world. I very much believe that. It won't happen overnight. But as we said, it's incremental, but we will help move you in the right direction together. And I think that speaks to our own vulnerability, that we're all still learning, that we're all still on this journey. But I think if we can just open the space to see, let's hear your ideas and what you're looking for, and let's empower you to activate the change.
I think that's amazing. I think what you're doing is you're speaking to the 25-year-olds now, which is so powerful. I think for myself, I'd say, don't be so hard on yourself, and don't think that the plan that you've got in place has to be completely followed. Adapt as you go. And I also think adapt your ways of being heard to the listeners. And hopefully by the time you get to where we are in our lives, they will be listening as you have learned to listen. Because I actually think, Shelley, sometimes you do have to adapt to the people who are in the power seats. It's got me thinking, actually, Shelley, and we've done 3 podcasts, and we said that we were going to do 3 because it was a nice, lovely little trio of subjects. But maybe we will take it in-house and think about getting a panel of the 25-year-olds to come and ask us questions. And then we're practicing what we preach. And then they have to do the hard, the heavy lifting. They have to do the prep. But also we can be seen to be listening and being authentic at that same time. Yeah, I'll take that in-house and we'll see what we can do. But can I just say a couple of things, really, Shelley? It was a pleasure to meet you on the screen during the pandemic, and to get to know you then on the screen, but in a one-to-one. And now to run through these really key things that we're both very passionate about, in almost like a conversation that is deeper than just a chat, but also has retained that chatability. I think has been an absolute pleasure and a joy. And you can tell I don't want it to stop. So I'm going to suggest we might do a bonus episode if you'll be up for that. But thank you so much from FIP, really, Shelley. Any reflections from yourself?
Oh, thank you, Catherine. I've just learned a ton having this conversation with you now. I feel inspired. I feel charged for the day. It's early in the morning here in Canada. And I think that's what we want to do, right? Is we want to have the opportunity to fill everyone's cup, to fill each other's cup and our own cups as well, so that we can continue to do what we love to do and drive the passion. Thank you so much.
Well, it's been amazing having conversations with you, and these definitely won't be the last. So those of you who are just listening to this as your first one, go back and listen to the other 2. Send us ideas for more. You can tell Shelley and I are keen to continue our conversations, and I really would love to have some of our 25-year-olds, age is not a limitation, to come and join us again. Thanks so much, Shelley. You've been a star. Thanks a million.
Thanks, Catherine.